Yeah, I am indeed Seamus ONeill. I'm the chief executive of this thing called the Northern Health Science Alliance, and I think that following Hugh and Louise, whose roles are very much clear to us and valued by us, I'll probably have to explain a little bit of what we do in terms of context. But I've been the chief executive now of this thing called the Northern Health Science Alliance for 8 months. And I'm loving the job of building up what is an alliance of centres of excellence in health, research, and innovation across the north. So I'm very much coming from this from the view of what can be done with localism and regionality and buy-in and being close to the population. That's not, as Louise said, this is not a binary thing, central versus local, but there are facets of those two perspectives that are valuable in different situations, and I'm really going to concentrate on the value of localism at whatever scale you choose to accept that. So the membership of the alliance that I am chief executive of is the large NHS trusts, the research intensive universities, and the academic health science networks across the north, and I run a small team of about 8 people who work for them at North of England level. In broad terms, our mission is to unlock the combined potential of those organisations and the North's life sciences assets for the benefit of the North, the region, people, and its economy. So our day job, day in, day out, we support and make visible the excellence in research and innovation that exists across the trusts and the universities, very often pushing that water uphill in a national context and making it visible internationally, where there's an appetite to work with the clinicians and universities of the North and the HSNs as well. That excellence, I do not visibly have a chip on my shoulder, but that excellence is often overlooked at national level. And the pandemic approach politically and operationally has yet again demonstrated that. As Louise said, the effects are disproportionately felt in the North because it is a disease of inequality, a condition of inequality. The effects on the economy will be disproportionately felt here. The recovery will be more sluggish. We know that. So this really matters. There is a levelling up agenda that was very high profile before this particular bomb went off. It's still there, and everything that underpinned it is still there, but it's going to be worse. So our role in the NHSA is to build durable, effective networks across the region and showcase those areas of strength. Now, in doing that, there are some lessons we have learned in very practical operational terms. I've been involved in some very enlightened projects. One was Connected Health Cities, which Louise has alluded to. It was a £20 million project over 4 years funded by the Department of Health and Social Care. It's just published its impact report, and it was a Northern Health Science Alliance project. 20 million sounds like a lot. Over 5 years and 16 million people, it's about 25 pence a year per citizen. So my role in that, I was in my previous role in the Northeast and North Cumbria was to help set up the Great North Care Record, integrating data and putting up interoperable systems in place and solving problems. Now we did that with a local mandate and using the practitioners and solving the problems that matter to them. And as Louise has alluded to, in cities like Newcastle and Liverpool and their environs, there are now assets there that would not be there without that, and civic trust that has been built from the ground up by answering questions that matter for safety, for efficiency, and for practitioners to do their job. It's got staff retention and transformation written all over it. It's also got a response to COVID and the public health written all over it. And those networks, you have to build them in the good times so that when the COVIDs of this world hit the fan, when you see a black swan event, you're ready for it and you've got the systems in place, the trust in place and the relationships in place to be able to do something about it. Now, the real key here was Department of Health and Social Care gave us the problem, and we distributed the problem amongst clever people. We didn't tell them what to do, and DHSC gave us space to do it properly. There are some enlightened parts of government that can do this and know when to be tight and loose, and that is priceless. The stage gate Gantt chartery of this world is dead. This is a complex system. The answer is not AI. The answer is getting people to work together and building high levels of trust with the citizens. Now, our system is not actually set up to do that at the minute. There's nobody from the north. There's no northern voice on the scientific advisory group. There is no regional voice in the political systems of this either. The devolved nations have a hard enough job getting noticed. So we think there are lessons to be learned in this. The prize is not just how you deal with the next pandemic. I think the prize is how you keep the UK political and social systems together.